spreads more widely among younger people, it's leading to more enforced self-isolation for students, such as the concern for youngsters and mental health, that some colleges are implementing new measures into their curriculums to help students recover from the negative mental and physical impacts of lockdown restrictions. Joining me now is Dr. John Price, who is the headmaster of Worksop College and Ranby House, where a number of students are self-isolating. Thank you very much for being with us. So, as I was saying, I mean, the virus seems to be spreading more rapidly among the young. That means many children are being forced to self-isolate. How are they coping with that, do you think?
It's been incredibly difficult. In fact, as you've already mentioned, the Delta variant is clearly prevalent amongst young people at the moment, and we're seeing obviously a number of cases of isolation. In fact, only this weekend, we had a young person who had already been isolating because of a close contact to a case, who then tested positive and was actually, would you believe, due to fly home. He hasn't been home to see his family overseas for a year, so he's been with us. We're a boarding school as well as being a day school. So he's been with us for a year and obviously has had to now self-isolate again for another 10 days. So you can imagine the impact on well-being has been huge. Fortunately, from our point of view, as soon as we went into the first lockdown back in 2020, we were well prepared. We had a very good learning platform up and running, which the pupils obviously could access. So we did face-to-face lessons all the way through, literally from sort of 8:30 in the morning to 5 o'clock, including extracurricular activities. So cooking along at home, all those sorts of things, which obviously were important in terms of well-being for our pupils. And we've maintained, Mark, that blended learning throughout the whole year. So any pupil that currently has to isolate because obviously of close proximity, or if they have tested positive, immediately accesses our remote learning platform as well. So we have this blended learning model where the staff are obviously teaching the pupils who don't have to isolate in a classroom situation, but then again, of course, are maintaining that contact face-to-face on the computer screen with pupils who are having to isolate.
Yeah, well, good for you on that. I mean, I'm just sorry to interrupt. I mean, good for you for doing that. But it is, I guess, the early teen years when children thrive on that social interaction. And so the absence of that is a problem. And I guess, is there a fear too of getting left behind academically, or have you kind of sorted that side of it with this blended learning?
I think we've managed to maintain the academic side of things with the blended learning on the whole, but I couldn't agree more with what you say about the interaction with their peer group. And I think that was the biggest thing, having come back from lockdown, pupils immediately saying, we've missed our friends. And that's something we've been desperately keen to try and make sure we've done. So even with, as you'll be aware, the teacher assessed grade situation, we've ensured that at the heart of everything has been the well-being of young people. And clearly, throughout schools across the land and young people and universities as well, the impact has been huge. I've got a daughter in year 13, so obviously I speak as a parent as well, and I've seen the impact on young people and the effect it's had on them, and trying to make sure that actually well-being has been at the heart of everything that we've continued to do throughout this period and since they've returned. And obviously trying to make sure they have some fun, Mark. Making sure that we've got back into participating in sports as much as we can, drama, music, all those things. And obviously making sure there's always someone to talk to. I've actually, made sure that we've appointed a well-being lead. It's a statutory requirement now next year in all schools, but we've managed to appoint someone early, and we've been going through mindfulness and well-being sessions with the pupils. And that's been something that's been on offer since they've returned from lockdown.
Yeah.
So we're seeing a huge effect on the mental health and well-being of young people at the moment.
It's interesting. I was reading a study from the States earlier where it said that, because they have children, many self-isolating at the moment as well, but they had a study that suggested that for socially fearful children, or children who are maybe being bullied, or they have other reasons that they don't really want to socialize, their mental health has been improved in a sense by being at home. And some of them have actually grown more sort of virtual online connections and end up with more friends at the end of it.
Yeah, absolutely. Undoubtedly, we've seen that. And in fact, pupils who are more reticent in a classroom situation, maybe lack a bit of that confidence to speak in front of their peers, have come to the fore online, undoubtedly. So it has been a benefit to those peoples. But I would say the vast majority, of course, who want that interaction have struggled. And of course, being back here, interacting with their peers, we've seen quite interestingly a number of peoples that have wanted to return to a sort of flexi boarding situation where they've been staying overnight with their peers, almost a sort of big sleepover, for want of a better term, so that they can interact and engage with friends that obviously they haven't seen for long periods of time during the lockdown period.
And where would you stand if it all got the go-ahead on vaccinating sort of 12 to 18-year-olds? It's not there's slight reluctance at the moment. They're waiting for data. I mean, they're doing it in the States, and we're going to talk to someone about that in just a moment. Where would you stand on that?
Yeah, I mean, obviously, there's got to be we've got to make sure it's safe, and there is no risk to young people, clearly. But understandably, weighing that up against the I suppose the mental health impact on young people as well of isolation. And if we're going to go through this continuing period of having to isolate for 10 days, of course, the impact is huge. I've had some people that have had to isolate 4 times during the year. So 4 periods of 10 days. So, on one occasion, of people that came back and literally was in close proximity with the people who tested positive. So immediately that afternoon had to go back home again. So I think the impact would be a positive one in those terms, and of course in terms of the staff as well, because again there are concerns amongst the staff. Whilst most of them now have been double vaccinated, there's still anxiety, as there has been for the last year or so.
Okay, look, Dr. Price, we appreciate you talking to us. Interesting stuff. Thank you very much indeed.
Pleasure. Lovely to speak to you, Mark. Good night.
Now.